you looking back, what are 3 or 4 things that you're particularly proud of?
The students, I guess, just we've done an amazing job at getting really a lot of Nevada kids. I think we had all Nevada kids in the beginning, and now we can get as many as we can get.
What have you learned from them?
How important it is to come from various different areas, cultures, backgrounds, economic strata, and how driven they are to actually make a change in the world. There was a while when everybody wanted to be a doctor because they made a lot of money. I think students now are much more objective about it. They want to
Mhm.
make a difference and in a more altruistic way than it ever has been before.
It is my great pleasure to have you here, Dr. Barbara Atkinson, founding dean of the Kerkorian School of Medicine. You are one of the nation's most celebrated builders of medical education institutions, and I know you don't like what I'm saying here because you don't like hearing this stuff, but look, you're the first woman, the only woman actually, to have been head of 3 different medical schools in the country, dean of the medical schools. You've been on Obama's bioethics commission. Your pathology textbook is either one of or the largest selling textbooks in the history of medicine, which is fantastic. I mean, there are so many different places where you've made a contribution. We're going to talk a lot about all of this. We're going to talk about your leadership. We're going to talk about how you raised somehow $13.5 million in 60 days. We're going to talk about a lot of different things. But I want to say this first, Barbara. It is a very sincere pleasure to have you here. I wouldn't be here. We wouldn't be here if it wasn't for you. So thank you for being here.
Oh, thank you for having me here, but also just thank you for all those words. But it wasn't just me, it was everybody. Everybody worked together to make all this happen, and it took a team for sure.
It did, and you are the one who started that team. Well, I'll tell you what. Let's go back all the way to the beginning, right? Your origin story from the very first inkling of you wanting to be a physician. Where did that come from? And then we're going to go through your story as we go through, and we're going to talk a lot about the UNLV School of Medicine, the Kerkorian School of Medicine. I was there for part of it with you, but there's a lot of things I don't know, but I want to hear from you.
That's great. Well, I'll certainly tell you, and you were there from the beginning. I think the first year I met you and you started in, so really from the start. So you're one of the founders too. So my story is pretty simple. I wasn't interested in being a physician. I was interested in being a scientist. I got I got involved in that in high school. My dad was a PhD biochemist on the faculty of the medical school at Ohio State, and he had an electron microscope, and I did science fair projects using his microscope.
Wow.
It was the first RCA number 3 in the United States, the first one, and I was a technician for it, and then did that through summers in college, and actually for the first year after graduation from medical school, I got married then and was worked for a year as a technician for electron microscopy.
We've known each other for
Yeah.
more than 10 years now. I never knew that story about your dad. That's fascinating.
It was, and he was the one that really interested me in science. He worked in cancer research, and he had mice that he grew squamous cancers on their skin from cigarette smoke. And so I saw these mice with tumors on them, and I never smoked.
Wow. Roughly what year was this?
It would have been 55, 54, something like that when I started.
So what's crazy to me about that is and your dad are showing at that point the dangers of smoking.
Absolutely.
And that was the highlight of people saying how good smoking was for you.
Exactly. And it was the time everybody smoked. There
Yeah.
was nobody my age that didn't smoke. I was really the outlier of all that.
Yeah.
But then I got married right out of college. I was a biology and chemistry minor, biology major at a small college, Worcester. It was very good science and very good music. I played the flute, and I liked both science and music. I got married right out of college, worked for a year, but was pregnant the first year and had my kids right away. And my husband had graduated from medical school at Ohio State and was moved to Philadelphia. He matched as a resident at Jefferson Medical School in Philadelphia. And so we lived in Philadelphia then, and he was in the military as a flight surgeon. He was a pulmonary internist and a flight surgeon, got called to Vietnam for a year. And during that year, I lived back in Columbus, Ohio again, and did biochemistry half-time, and decided then that I wanted to be a PhD biochemist like my dad. And when I told him that, he said, absolutely not. He said, go to medical school. You can still do research. You can do anything you want, but the world is open to you to anything you want to do, and that it's a lot easier. You just have to graduate with 200 other medical students and graduate, as opposed to being a PhD student and having to.
How many women were in your class?
There was 10% exactly, which was 21. We had 220 medical students actually in my class. Then, and now we talk about 60 as being the number here at UNLV, but back then, I graduated in 74, so that was 51 years ago. We had 221 students in my class.
So your husband, Bill,
right?
Also Dr. Atkinson, he told me a story one time about Ohio State and Jack Nicklaus and how I guess they ran into each other on a regular basis.
Yes, because he played golf too.
Yeah.
And Jack was from Columbus and played at the golf course right near where my family lived too. So yeah, Bill did.
Yeah, he was a pretty good golfer. So,
yes.
Okay, so cytopathology was your specialization, right?
So my dad was actually very upset when I went into pathology because he'd always had to work for pathologists who ran clinical laboratories. But anyway, he recognized that was particularly good for me because I could do research at the same time as I actually did clinical activities. And I specialized very much just only in cytopathology, which is the diagnosis of tumors by cells, by looking at cells under the microscope and diagnosing tumors. And sometimes it's infections or something not malignant, but mostly tumors. And I should mention that the books I had in pathology were all in cytopathology. I had 8 different ones of them. But the main text at the time, at the early stages of cytopathology, was diagnostic cytopathology.
Yeah, that you
text.
had written.
Yeah.
You know, it's interesting too. These formative experiences that we have, like you had with your dad, and then cytopathology makes sense from based on that. Are there other people in your life that have been mentors for you or role models for you? It sounds like your dad was one of those.
He was for sure, and my husband was the major person in my career. When I was doing everything, women were not doing anything, and they weren't moving into upper ranks of medicine for sure. So Bill was the main person that actually helped me not make mistakes. There was a time, for instance, when I should have been promoted at Penn. I went to Jefferson to medical school and graduated, and then was a resident at University of Pennsylvania, and then stayed on the faculty. And I was the head of pathology, and then I started a research laboratory with the Wistar Institute doing monoclonal antibodies and had an NIH grant. And anyway, I should have been promoted to an associate professor at that stage. And they promoted a man who was in the same class as me, but didn't run any laboratory and didn't have a research grant. But he had a wife that didn't work. And so they told me that since my husband worked, I needed to
my goodness.
just not do it. And I was ready to sue or make a scene. And Bill said, just be calm. Just let everybody know that you're unhappy about it, but that's it. Don't make a big scene. And sure enough, the next year they decided that I needed to be promoted.
You know, I got to tell you, there's so many things about that story. One of them is, as you were going through all of your accomplishments, and then you said, being promoted from an assistant to an associate. I was thinking you were talking about being promoted to a tenured full professor with all of the things
No.
that you were doing.
There was only, at that time, only one woman that was a tenured professor in the medical school, and she was, as you can imagine, outstanding at the University of Pennsylvania, but one. So there was not even a role model there, basically. I did have one woman mentor very early on. She had been a resident with Bill and then stayed on as a good friend. But on the whole, I had men mentor me. I would suggest for other women, it's nice to be able to find women now who can do that. And I have tried to help numerous women along the way because that's important to really understand what it takes to have the right personality to get along.
Yeah, I mean, I think about the leadership that you brought in and fostered at UNLV, and there have been a lot of women that have been in leadership positions have done a fantastic job along the way as well.
I'm proud of that.
Yeah, you should be. And we're going to have a whole list of things that you should be proud of along the way. There was some time along the way where you decided, okay, I am a physician, I'm a researcher, I'm a mom, I'm a wife, and now I want to be a leader. When did that happen?
I sort of just built into it. They hired me right out of my residency to lead the cytopathology laboratory. It had a leader, but it had not had a full-time person doing it. And it had about 25 people in the group, so it was not a small group. The person who was in charge of anatomic pathology basically managed it himself and did everything, but I was hired to set it up and to start a residency program there. So I sort of fell into it. I started learning how you manage budgets and started learning things like that early on, probably earlier than most people would do. So it was part of everything I did. I started the residency program and then a fellowship program in cytopathology when fellows were new in that. The specialty was new at the time. It was an exciting time when until then cytopathology had been pap smears and you did pleural effusions and cerebral spinal fluids, but that was pretty much it. But we started doing needle aspirations of everything for cancer: pancreases, thyroids, brains, lungs, kidneys, livers, everything. And that was a time when, before that, if you made a diagnosis by cytopathology of cancer, you still had to prove it by a biopsy. But at this point, they began recognizing that cytopathologists could make the diagnosis too, and you didn't need to prove it by a biopsy. So it was really an exciting time.
That's a huge shift in the field, right? I mean, it absolutely changes the way you go about it.
It did, and it gave many opportunities for writing papers on what thyroid looks like when you just look at cells and different diseases of the thyroid, for instance.
Can you kind of help me understand this? You've got a family, you've got a full life, you've got all of these things. What does it feel like to be a woman in that environment that is a male-dominated environment at that time?
Yeah. It was less male-dominated than some specialties. I, in fact, wanted when I was going through medical school, the thing I liked the most was surgery. And I actually interviewed for surgery residency programs and realized that the place where I'd done my surgery rotation as a medical student was very welcoming to a woman, but most residencies were not, and that the lifestyle was going to be terrible, and I couldn't manage a family. My kids started grade school basically when I started medical school, so during that time after medical school, they were getting into adolescence, and by then I knew that I wouldn't even see them by the time I finished my residency if I did a surgery residency then. So I picked up a lifestyle that was something that I could manage and do research at the same time, and that was really, and then be very focused on within pathology so that I could learn an area, cancer, really well and really focus on that. So I could manage a family and work in that environment. But I think women need to figure very clearly what it is they want to do and when they want to do it in order to make life important for all aspects of the life.
It's, one of the things that you said, which, on the one hand, I don't want to go back to this, but I'm just dumbfounded by it. You didn't get a promotion because your husband was a doctor, right?
Yes.
Like, that's just crazy to me to think about.
That's the way it was in
Yeah.
the olden days. And it's a little bit that it's not as overtly said. I mean, it was overtly said back then, but not so overt now. It's still maybe there, but definitely not as overt.
So, in addition to leadership,
Mhm.
you moved into bioethics.
Yeah.
So, talk about that transition a little
It
bit.
it just came about dealing with ethical issues about when to tell patients. During the time that I was first doing cytopathology, a lot of people were still not telling people what they had. If they had cancer, they kept it a secret, or they may have told other relatives but didn't want the person to know. I mean, it was not like it is now where patients know what they have and what the treatment is and are consulted in it. It was more like doctors decided what to do. And so I first got interested in that and got interested in some other ethical issues of treatment of children, for instance, and how they're treated. And I was lucky enough to be in Kansas a- as Obama was elected, and the person who was the governor of Kansas was a good friend of mine because I raised a lot of money through the legislature to build an NCI designated cancer center in Kansas City. There wasn't one in that whole region, and we made a good case for it. And it took 10 years to build the infrastructure for that cancer center, and that governor was very, very invested in being sure that happened. And when she got made the head of Health and Human Services, Kathleen Sebelius, and Obama set up as bioethics commission, she asked to have me put on the bioethics commission, and that was how I got involved in that piece of it. It would not have happened without her and without him.
Yeah.
But we had a really incredible committee that made a lot of important decisions, looked at cases that were really important and made decisions on new technologies. One of the things was looking at an anthrax vaccine for children. The federal government was requiring everybody who was in the military to have an anthrax vaccine, so all military people, male and female, were getting an anthrax vaccine, but nobody had ever tested a vaccine on children. And anthrax is actually probably still the as a bioagent, probably the top priority worry. At least it was back then. The Association of Pediatricians thought we should test it, but what are the rules? And we decided to start with younger recruits at 17, 16, and start to move down age-wise and then begin testing. Because if you even look who would sign up their kid for a test of something that hasn't been tried before in a child, well, military might, but you could say that they would only allow it because the government would tell them they should or must. There were real ethical issues about it all. So we looked at a variety of really interesting problems.
It's thinking back not very far, but the vaccine for COVID
Yes,
and some of
exactly.
the ethical issues that are associated with that, and thinking about what you just talked about with anthrax,
Yeah.
children,
Yeah.
younger adults, older adults, and so forth. Were there lessons, things that you learned from that experience that then impacted the way that you practiced medicine?
It certainly made me realize that that was an area of medical education that ought to be
Hmm.
improved, and I felt very strongly about that and still do, that that's an area to work on. There were other areas other than bioethics that I thought needed to be better done in medical education and public health and the treatment overall of public health, and that's, if anything, gotten worse after COVID, because the general public does not understand that the health of everybody in the whole community affects their own health, because diseases pass on from one to another, many of them, and so looking at public health and how overall public health is important is key. and just other major issues that I brought to UNLV, because they weren't things that were key to what I thought medicine needed to concentrate on in the future.
This topic of public health, I want to talk about it more, but I want to put it in context because one of the things, one of the flags that you put in the ground when you got here, and it's still here, which I'm glad, is the idea of community outreach and serving our community. So, can you talk a little bit more about that? And it sounds that that's something that you didn't invent here. You brought with you from where you were.
Well, I didn't bring it as it was, but I knew other places that were doing it, and that the main thing right from the beginning in the curriculum was at the very start of the curriculum to teach medical students basic emergency medicine so that they would be able to handle an emergency if something happened. Even if they were a medical student, they didn't have to have a residency in emergency medicine to know what to do in the case of an emergency, but also to understand their community that they came from. So we started a program where we looked at the I think 10 worst zip codes in Las Vegas, worst in terms of healthcare outcomes, and they take time during the summer of their first year to spend a month or so visiting one of those zip codes and learning about how many bars there are relative to how many grocery stores, and do grocery stores have vegetables in them, or do they just have booze in them? What are their gangs? What are the real health impacts? How close is it to a hospital? How close it is to a doctor's office? How would a person get there from that neighborhood? And really understanding what helps people get health care and also hinders them from health care. And I think that makes a big impact when you do it at the very beginning of the medical student's career. You then understand it throughout as you're seeing patients and seeing the issues they have, making decisions about whether to pay for the pharmacy or whether to pay for something else instead.
One of the points that you're making, which I think you've done a great job setting this up for the School of Medicine, a lot of people, I think about being unwell or disease as being affecting that individual. But in fact, it spreads much more than that individual. Not even necessarily the disease, but the impact of the disease.
Absolutely. And the whole community suffers if some of the community is impoverished in the way they can buy vegetables, for instance.
Well, and in the downtown area, especially when you very first got here, had none of that. Had no
really
grocery stores, and
it's much improved now overall. People are really recognizing that they need to pay more attention to that.
One of the things that, and you've been really helpful for me to see this, is that often, and unfortunately, the disenfranchised are usually the ones who are most disenfranchised by those types of things. Like, they can't necessarily drive someplace to go to a grocery store, and there aren't grocery stores in their neighborhood.
That's exactly correct. Yes.
Yeah. It's been, I think it's one of the, things that you should be very, very proud about, establishing that from the very beginning, even before the med school started. You started the idea of reaching out to our community.
Yeah. Well, that was my whole purpose in coming here, was to first understand Las Vegas, and to do that, you have to meet people and talk to them and find out what they need. And what was clear was there was a huge doctor shortage, a huge nursing and other allied health shortage. I mean, so it was shortages of everything, but the real issue was people also weren't working together and weren't working at the basic problems as well as the healthcare problems. And you really have to take care of the whole community, not just the healthcare piece of it, although the healthcare piece of it is the main thing. And then really understanding what people wanted, and what they want is to be able to get good care here and not have to go someplace else for it, and we're still a long ways from that in Las Vegas, but it's a lot better than it was.
No doubt we've made strides. And I want to talk about this in detail because there are things that you set in motion that are continuing, like the community outreach, like the EMT program, which sounds so obvious. If you're going to be a med student, you should know basic life support.
Yeah.
You probably know this story about one of our first-year students.
Yes.
Tell the story.
Well, one of the first-year students was just driving in a car and saw somebody whose arm was cut off right in front of her, basically. And she hopped out of her car and did first aid, and the arm was sewed back on and basically saved. I mean, it was really remarkable. And she did an incredible job. I mean, it still gives me chills to think about it. So
I love the story, and one of the things about it is in a lot of different medical education settings, she would have to wait for years before she was even remotely competent to do that.
The classic medical school curriculum just didn't. Actually, it did lectures for the first 2 years and then started in clinical activities on the third year. So she would not have been able to do anything. She would have just felt bad.
Yeah. As it was, a very different story.
Exactly.
Yeah. I love that story as we're going through. So let's go back because the medical school, like you were retired when you were asked to come and not just be a dean of a medical school, but actually start the entire medical school.
Yeah.
So let's talk about that story, but also what in the world possessed you to say, yes, I'll do this?
Well, that's a whole, I'll get to that, I guess. So when I was in Philadelphia, I sort of left I was at Penn, and I got asked to interview as a chair of pathology at Medical College of Pennsylvania, which was the women's medical school in Philadelphia. And after thinking about that for a while and thinking about what I could do there, it was a little school compared to Penn. It was I would say, a low reputation school compared to Penn. But I could do something, and I could look at a residency program and decide what I could do that I wanted to do better. So I could actually think about what it needed. And I did that, and just as I moved there, Allegheny Health System took over that medical school, and 2 years later, it took over Hahnemann Medical School, too. So that was in 1990. And we combined two medical schools and had to teach both courses for medical students in both schools. One was 175 kids, and one was 220 kids. So we had almost 500 medical students in two classes. We actually had to teach 3 curriculums for part of the time because the accrediting agency said you had to keep the curriculum that the students entered with for a whole 4 years. So anyway, that was an interesting experience. But I was chair of pathology in both those schools and was later dean there. In 1996, I became dean at what was called Medical College of Pennsylvania. And as Allegheny Health System went bankrupt while I was dean, it became Drexel Medical School. So I was dean for 3 years there, and it was a very exciting 3 years, the first 2 years, and a terrible and depressing last year, but a very interesting one because I really learned the finances of healthcare and learned what cheating had gone on to make the bankruptcy happen at Allegheny, and had to testify in all of the trials for that too. So that was an interesting experience, but I decided I never wanted to be a dean again. I wanted to be a pathology chair, and I had a friend at the University of Kansas, and she was looking for a pathology chair and couldn't find one, and asked me to just temporarily come for 3 months and help her get through some hard stuff. And when I did that, I loved Kansas City, and it was the fall, and we really loved it. So I moved to Kansas as pathology chair, but when she left to move on to be a dean at University of Minnesota Medical School, they asked me to be dean at Kansas, and so I decided that it's the same thing. I could see what I wanted to do and see what I'd be able to do, and saw that I was dean for 10 years there, an executive vice chancellor for the campus for 8 years. And I saw what I could do there, and it was really impressive. And we, as I said, got the NCI designated
Right.
cancer center, which was huge. That was one of my main things. I wanted to get a office building for the practice plan. I wanted to get research, cancer research in particular, but all research expanded. We were able to do that, and we had to change the curriculum. Actually, changing the curriculum was the easiest part. That was the one I thought was going to be the hardest part, but actually that was the simplest. And getting an affiliation agreement with the hospital. So all of those got accomplished in 10 years, and I retired and was 2 years retired in Kansas. And I was okay, happy, but not, but I still had.
Not fulfilled?
Well, I was pretty fulfilled. The first year I was just tired. I mean, it's a tiring job
Yeah.
being a dean
Yeah.
and executive vice chancellor for a whole campus and for all the decisions and whatnot. So the first year I was okay. The second year I was sort of at a loss. But I got a phone call from the provost at UNLV to see if I could consult on starting a new medical school at UNLV. And in the fall of 2013, the Board of Regents had approved a site for a medical school at UNLV, but they wanted it to be under UNR, to start out under UNR and then maybe convert to a UNLV School of Medicine. And I was going to be a consultant. I was scheduled to come in January. And interestingly enough, the president changed right about the 1st of January that year. And when I came, Don Snyder was the brand new president who had just started. And I told him, as did every other person that came to interview. And actually, when I saw the interview schedule, I knew it was not a consulting interview. It was looking at a dean's job interview, because they had me meeting with everybody who was important in Las Vegas. It needed to be under UNLV and not under Reno, that you don't start out a new school under an old school. You need to start it new and let it be a new school.
Let's put this in context, because UNR Reno had a medical school.
Yes.
But the majority of their residencies was here in Las Vegas.
Yes, and they had medical school faculty in Las Vegas, and it should have been approved as a site under the accrediting agency, but they never approved Las Vegas as a site for their medical school. It wasn't even an approved site. Every other medical school that had 2 sites, for instance, Kansas had a Wichita site, and it was an approved site for 3rd and 4th year students under accreditation. They never had done it, and they should have done it all along. Another good reason not to let them start under that umbrella here. But they didn't want to have it to be any part of UNLV, really. They wanted to run the entire thing.
And there was legislative pressure to not have a second medical school as well, right?
Huge legislative pressure from Reno. The North. The Southern legislators, almost as soon as I came, really wanted to have very desperately a UNLV school that was UNLV and was going to be a Southern Nevada school. And so when I was hired to see during that first year. I was hired in May of 2014. And when I was hired, I interviewed in January, and they said that I was the top candidate and that I would have a letter of offer in a couple days. And then I got a phone call to say that they were going a different direction and somebody else was going to do it. So I said, fine, I'm fine. And I was actually on a vacation celebrating my 50th wedding anniversary with my husband in Spain. And when a phone call came saying, we'd like you to start tomorrow. Literally.
Well, hold on. They say yes, then no, then yes, tomorrow.
Yes, and that was April. So between January and April, they changed their mind and wanted me to start right away. I said, well, I'm in Spain until May 1st. And they said, okay, start May 1st. And I said, I can't start May 1st because I told my kids they could come and visit me in Florida the second week of May. But it turned out they needed to get a 10-year budget to the legislature, had to be approved through the regents by something like May 15th. So they wanted a 10-year budget, and I was in Spain.
Yeah.
So luckily I knew budget people that could do a 10-year budget. And they had Trip Umbach, who had done the original report, had a budget. And we could do a budget after I got back in May. But
in
it
2
was
weeks,
in 2 weeks.
less than 2 weeks, a 10-year budget. Do you know what happened in the yes/no situation? Like,
Oh, I do. That was the first thing I asked when I got the phone call to say they wanted me,
Yeah.
was what happened. Somebody had looked at my background and saw that the editor of the Lawrence Journal World, University of Kansas, the main campus is in Lawrence, Kansas, which is about 50 miles away from Kansas City. The medical school's in Kansas City. So I was very popular in Kansas City and the medical school, but the Lawrence person, who was the editor of the newspaper, who wrote an essay every Saturday morning, liked the hospital director and not me, and had written terrible things about what I'd done for a couple years as we were doing the affiliation agreement. So he looked at all these editorials from the Lawrence Journal World, and nobody in Kansas paid any attention to that at all. And anyway.
wow.
But that
and
was
that's
it.
why that was it.
And as soon as they got past that hurdle, they decided to hire me.
It seems like, I'm just thinking about from a diligence perspective, it seems like something other than a single writer at a the university newspaper would have a pretty big sway. That seems outsized as far as the impact that it had.
It was, but it was pretty nasty while it was happening. I mean, I didn't look at my Saturday newspaper ever for a couple years because it was so outrageous and outrageously wrong. But people that knew what was really happening knew what was really happening.
It seems like there are a lot of things that you learned at Kansas that could transfer pretty easily.
Sure. What I knew was you needed to build community support. Everybody in the community needed to want you to do what you were doing, and you needed to do the building by having a plan for what you wanted to do. And that's where I looked very early on at this needed to be really a community program that would support healthcare for the entire community, and that would do more modern things, a problem-based curriculum, which is a more modern curriculum, but it's a more expensive curriculum to provide because you have small groups of students, 6 or 7 students with one faculty member, as opposed to lectures of 60 students.
So sorry to cut you off, but the problem-based curriculum, that model, from a curricular perspective, from a pedagogical perspective, makes so much more sense for medicine because instead of retaining 10% of or 11% if you look at the research of what you hear in a lecture, because you're engaged, now it's far more than that, 50, 60, 70%.
Yeah, and you're engaged with it right from the beginning on a patient level. So it's a paper case, so you just have what's written about the person, their age and their chief complaint, like a cough, and then what the physical exam shows, and you go through the patient, what the lab tests you would order would be, and then what the set of things to consider the diagnosis to be, and then how you rule out all of those and the lab tests that would rule it out or not rule it out, and then what would happen at the end. And so you can put all the bioethical pieces into it, you can put all the pharmacy stuff into it, you can put all the infectious diseases, or you can have a case of TB where it turns out it was a teacher in a high school that gave it to kids in the class, and and how you would handle a public health episode like that in a school. I mean, real things that have happened in the past, but you're seeing it as a beginning medical student, an entire case and an entire way that the thought process works in teaching.
Yeah, which is so important instead of just memorization.
Right.
And so you are training individuals to be holistic in their
Right.
approach.
And to learn how to use the literature
Uh-huh.
to find the answers too, that it's not only what you know or what you learn, but also you can check what the reality is in the literature, and that's really important.
Did you have PBL, problem-based learning, at Kansas?
I made the curriculum change
Yeah.
to that when it was there.
Uh-huh.
Um, I started it in 1990 in Philadelphia, so it wasn't a a new curriculum. It was actually started about 1990, so it was an older curriculum, but most schools didn't bother with it because it's hard to do for a class of 220. Easier to do a lecture with one person,
Right.
and but in both Kansas and in Philadelphia, we had part of the curriculum done that way, but not all of it. But here we could start with 60 students and do the entire thing, and it's a great curriculum. And then the other piece of the curriculum I was really strong about was that we needed to, instead of doing just gross anatomy, to learn anatomy, which in my mind was not the best way to learn anatomy. We did it all electronically
Mhm.
because you can look at it screens of X-rays and be able to see the whole body and really understand the way that X-rays and CT scans and MRIs now look at a patient, and that's a better way of learning the anatomy than seeing it in a body where it's sort of buried in fat and fixed stuff that's nothing like what a human really looks like.
It's interesting because one of the themes that I hear you saying is this holistic approach
Right.
to everything,
Yes.
right? So bringing in bioethics into medicine,
Mhm.
which makes very good sense, isn't traditional
Yeah.
necessarily. Looking at the patient in totality instead of just a section
Yeah.
of it, and then problem-based learning
Mhm.
as well. And where do you think this came from for you? Because it's a theme that keeps coming up.
It just came through multiple years of medical education. I taught. It's interesting as a pathology chair, you have to teach medical students for the whole what it is, and in pathology you teach the entire body. But as a chair, you also do residents and fellows. That's a huge piece of it. And so I had lots of experience of what works with students of all levels of medicine.
Okay, you say that as if it's obvious. It's not obvious to a lot of people because they haven't done it. I mean, I
Yes.
think your ability to observe and pay attention to what works and what
Yeah.
doesn't, and then be able to implement it, I think is
Well,
really
and then
special.
be able to tell people that this is what we need to do in a
Mhm.
new school, and I
Mhm.
think that was what worked for me was once I had been, and I spent the first 6 months really meeting everybody
Mhm.
literally in Las Vegas that I could possibly. I went to anybody that had a organization that had lunches or dinners or whatever. I went and gave a talk about what the school could do for the community and what would be the innovations that it would bring and what the outcomes would bring. And we had the study that showed that there'd actually be jobs and financial impact. And look at the medical district.
Yeah.
You can see the financial impact that's happened. It's over $2 billion in 10 years. So that all happens. You can say it, they'll either believe you or not, but if they
Mhm.
see the story actually says it's something that we think needs to happen, and I can make a case that it's the right way of doing it, or it's the best way that we have right now in medicine to do it, then the case actually people bought it. So in that first year, we had a year. Um, the legislature in Nevada only meets every other year, and it was meeting the next May. Well, it was meeting the next. They start in February and end to the end of May to the beginning of June, and so I started in May, and in that summer, starting August September, the Southern legislators um, started a forum for getting the top priorities for the next legislative session. and they had different committees of 5 groups, I think, but one was education, one was commerce and money, one was healthcare, and one others gaming and some 5 of them altogether. We ended up presenting the medical school for 3 of them, and it was the healthcare, the business and commerce one, and education. We ended up as the number 1 priority for the Southern legislators for that session for our medical school, and we were asking for $27 million in funding that first year. The first year would be just to start to set up all of the faculty people that would take to build the medical school, and then the second year of that would be the year that students would start. And so it was an interesting legislative session because I was told by all the legislators in the South that we were going to get the money. The governor, he was kept out of the loop and was told by Reno that we couldn't possibly start that fast and that we should just get $7 million and not the whole thing. But anyway, right up to the last minute, I didn't know for sure that we were going to get the funding. But the minute we got the funding, all of a sudden Reno came and said that we could have the whole medical school faculty and take the residents too. So they sort of gave us their whole operation. And I actually didn't want their whole operation. I actually had been planning that we would be setting up our own people in our own school and separate, but as it turned out, that was the best thing to do, and it worked. And their faculty was incredible. They started working on our curriculum, and their dean told them that they couldn't do any work on anything to do with UNLV unless it was before 8 in the morning or after 5 in the afternoon. So every committee met at 5 o'clock and did the curriculum and the student affairs and all of the stuff that had to be done to get. And you were part of all of those because all of those had to have real input into the UNLV process. And UNLV had no clue how to do any of this either because they'd never had a medical school startup and had no idea what was involved. The amount of money involved and the amount of people involved was just totally overwhelming to UNLV to even understand what was going on.
Well, we had, just faculty-wise on July 1, 2017, we had almost 150 faculty.
Right, who
and then,
didn't exist until 2 weeks earlier.
Overnight, flip a switch. I remember having a conversation early with in the university, almost everybody was unfamiliar with med schools. And so I remember having conversations with university, like they would ask questions like, what is a resident again?
Yes.
And, there was that translation piece that was, and what is a faculty and what is teaching and these things.
You can't just expect faculty people who are professors to have research grants and to still have a 50% salary on a state salary line.
Right.
You don't put an orthopedic surgeon on a 50% state salary line because you can't begin to pay them on state lines. You have to, and the rules at UNLV were that you couldn't be a professor unless you had 50% of your salary on a state line. It was ridiculous.
There were so many of those things that, I think if you didn't know, you would think it was the equivalent of starting a new department or something like this, but it's so very different.
Yes.
I want to go back to something you said. I've always thought this was interesting. You spent so much time in the beginning, 6 months or so, basically having a listening tour.
Yeah.
And yet everybody was just frothing at the bit to get the med school. Yeah. Like that takes a lot of discipline. I mean, I think it's exactly the right thing to do, but it takes a lot of discipline to be able to do that.
Yeah. Yeah. And it took a lot of support from a lot of people to actually do it. Don Snyder was incredible. And then actually the Regents did a very quick search and brought in the new president. And he started in November and had to get up to speed, but they even kept him from meeting with the governor until after the governor did his speech and said that they were giving money to the medical school, and it was $7 million instead of $27 million. So, and that was Len Jessup. He did an incredible job, but had to actually really get into it that fast because
Hmm.
it was already so difficult to actually get recognized.
Yeah, there were so many moving parts and so many
Yeah.
shadows and so many corners in this whole thing. It's kind of hard to describe all of it.
And part of it was the status of doctors in Las Vegas anyway, the of the whole medical community. Um, they hadn't had an academic focus. The one thing that they had was the attempt at a cancer center program that failed. So that was like a failure that was in a lot of people's minds,
Hmm.
that they were worried that we would do the same kind of thing and end up taking a bunch of money from people and then failing. So that was sort of one background. And then a whole healthcare system very directed by the insurance companies, more so than in the rest of the country, so that the physician payments were really lower than elsewhere in the country. The only good thing that happened was that was exactly when Obamacare came in, and that made UMC profitable. It went from being a $80 million a year negative to the county and the state to being a profitable break-even place. And that was a positive within that whole mixture. But other than that, it was a very difficult time for healthcare and in a very difficult way because this place had never had an academic focus before.
Can you talk a little bit about the Obamacare relative to UMC, and which obviously as our partner
Yes,
is important because the payer mix that we have is unique,
it is.
right?
It is. The payer mix at UMC is very much, even with, well, before Obamacare, it was all no pay patients. I mean, that was basically,
Because people didn't have insurance.
they didn't have
Yeah.
insurance, and that was really what they did, and that was where you went if you didn't have any money, and if you did have any money, you went to one of the other
Hmm.
hospitals. When Obamacare came in, you at least had all the people that were documented were able to get some level of care, and that care increased over time, as Obamacare brought in more programs and got better and better. And now it's going to be a big issue for the future because now it's being cut off at the bottom and it's being increasing the prices for the middle level Obama kind of care people too. And that's going to be causing even more people to be uninsured. So I am concerned about what's going to happen in the future and what's going to happen to a place like UMC that still takes a lot of undocumented people because you have to be able to go somewhere.
Hmm.
And right now, there's a law that says that if you don't have any insurance and you have an emergency, any emergency room is supposed to take you. But that's not really what happens. What really happens is most of the people end up at UMC. And that may be what happens again in the future. And I'm sure that's what UMC is thinking about, how they're going to be able to manage that as there are fewer and fewer people on Obamacare and fewer people who qualify for it aren't going to be able to afford the premiums that they're going to have to pay.
The idea of having a safety net
Yes,
for society, and now the safety net's getting holes cut in it
absolutely.
as we go through. And back to bioethics, right? I mean,
Yeah,
started looking at the ethics of medicine
yeah.
again become an issue.
And looking at just the basic things that you have to do to take care of your community. I mean, feed children. I mean, the single thing you can do to help a child's life for the entire life is feed them when they're young. And
Mhm.
here we had SNAP not being paid for and as many as a third of all the kids in the United States are on SNAP because they don't have enough money
It's
for
amazing,
food.
isn't it?
It
A
is
third of the
a
kids.
third of the
Yeah,
kids. It's awful is what it is to
yeah.
have this country and not have enough to feed all the children all the time.
Yeah, and this is another one of the reasons I think that you were so adamant about having our students reach out to the community in the very
Absolutely.
beginning.
Absolutely.
Yeah. Because some of it, one of the things I've seen from our students is they're not just physicians or physicians in training, they're educators as well.
Yeah. And I think a lot of them are going into education,
Mhm.
academic medicine
Mhm.
in the future too, and I'm excited about that. I've been in touch with some of the first class, so we've graduated 5 classes now, and that's really exciting. And
It's
so,
amazing, isn't
yeah,
it?
it is
Yeah.
amazing. So that means that a couple of them are, or a lot of them are out of their residency programs. A lot of them are taking a fellowship on top of their residency, and are still in training, but a lot of them are going into academic medicine, and I'm hoping that they're either here already or they're coming back, and I think that's gonna be the case, that
I
they are coming back.
I would love that. The you know, it's amazing to me to see the residencies that our students get, and, I
Unbelievable.
mean, it is just
It was unbelievable. That first year of that first class, and
uh-huh.
that it was an amazing
Yeah.
class. It was everybody who wanted to be a doctor in Las Vegas but couldn't leave town to go to some other medical
Mhm.
school. They were really incredible. Anyway, they got the most amazing programs across the country, all the best programs, Hopkins and Mayo Clinic and, you know, University of Pennsylvania, multiple ones, and just top programs across the country. And then the second year, those programs took other students of ours because they knew that the students that we put
Right.
out were
Yeah.
that good. That was amazing because the students who had come out of Reno did very well, but they didn't do anything like as well as ours did.
Those students, that first year class in particular, those were pioneers. Those
Yeah,
people were taking a risk,
a
right?
big
Because we
risk.
we weren't an accredited school at that point.
Yeah. We
Yeah.
had an accreditation to be able to
Yeah.
take students, but not a fully accredited school.
Mhm.
Yeah.
So it was a different kind of student really
Yes.
that came in. And those students also had scholarships because you had raised
Yes.
$13.5 million in a couple
60
months.
days,
Yeah.
60 days, 60 scholarships, whole
Yeah.
4 years of their
Yeah.
college, and they were very grateful. We had Chris Ingolstadt, who did 25, scholarships for 4 years, and she did 4 years of 4 years of scholarships too, so she
Yeah.
did an incredible amount. But being able to show the legislature that we could raise money like that to support a new school was pretty incredible, and lots of people donated to that, and I'm very grateful for all
Yeah,
that.
well, there was I mean, among the many amazing things, that's one of the ones that on paper may not look like it, but that is amazing. Scholarships for an entire class for 4 years,
Yeah.
in 60 days.
Yes.
Um,
Before they'd started
yeah,
or before we'd picked the kids.
yeah,
I mean,
yeah,
that was it was a promise, and that's what but that's what we needed to show the legislature that the promise was there. And it was from a lot of people. It wasn't just me promising it. It was the community promising it.
yeah. I mean, I will say one of the things about Vegas, right? Bet big to win big,
Yes.
and I think that that's what happened in this case.
Yes.
Yeah. So, there's so many different things that you're talking about: the community, the curriculum, the funding, et cetera, et cetera. Like, how do you even start a medical school? Like, it was a blank slate in a very unique town.
Yes. Yeah. Well, I guess I just assumed it was gonna be like any other place, and so it was only when I really got into it that I realized how different it was and how much there was gonna be to overcome because there were lots of things to overcome. Um, so so in the beginning, it seemed pretty straightforward, and I had strong support. One of the things was Don Snyder had been a very big money raiser, before. He'd done the Smith Center, and that was impressive, and
Hmm.
impressive that a community would come together and do a project like that. That actually is one of the pieces that gave me some confidence that this could actually happen here. And as soon as I got into it, then I knew it could happen. People were desperate to have this done. And even UNLV, which made its own barriers, wanted it done. It was never a question of that. Lynn Jessup was just incredible at really being able to support what we needed to have happen on the main campus to have it be accepted that that's the way it would be. Um, so it just had to work out, and I guess finding the right people in the right jobs, and it's hard because you want people that are aggressive enough to be able to get the job done and to know what they want to do and push it sort of regardless. But that makes enemies too, and
Mhm.
that you can sort of wear out your limits at some point, and that can make it difficult.
I don't think that you can do anything that is, such a huge impact in so many different areas and somebody not be upset.
Oh, for sure.
Yeah.
Oh, for sure. Yeah.
It's are there looking back, are there things that you would have done differently?
Not really. I mean, I think really it needed to happen,
Yeah.
all of it pretty much. I think it happened about as smoothly as it could. I guess the one thing bad was that I got sick and was out for about 3 months, right as when the school was starting, and that was a tough time because there was a lot happening. But it ended up happening, and I was able to get back.
Mhm.
I wish I had been younger. I wish I were 50 now and able to do it again from the start, but I'm not.
I'll tell you what, the what you brought up of being sick, that is remarkable, and a part of your legacy of the invincibility of Barbara Atkinson. I mean, and the timing of
Yeah.
that, right?
It was exactly the worst timing of
Yeah.
all. It was July of 17, just as the new class was starting and just as all the faculty moved over. I think that's actually what caused it. I had a rupture of my colon, and it was not thought I was gonna live. I mean, that was based I was in a coma for 3 weeks. I had a stroke as part of a low blood pressure stroke, and so I couldn't talk or walk, but in 3 months, I was able to come back to work. I was in rehab for a month, in the hospital for a month, rehab for a month, and home for a month, and was able to come back as dean, and I was glad to do it.
Yeah, it was. I can tell you that I was among the many people who were thinking about you and praying for you every single day. It was amazing. I remember
Yeah,
the first time coming over to the house
yeah,
and Bill saying, "Oh, she's doing good today," and
yeah,
having the conversations is so great to see too.
yeah. Well,
Yeah,
it was it was a tough time, but it was really, again, it was what was meant to be, I guess.
I believe that.
Yeah,
I absolutely believe it. Even those things that are very very difficult for us
yeah,
in the moment. Um, oftentimes those turn out to be something that we
exactly.
look back and we're grateful for. So on July 1,
Yeah,
2017, you are in the hospital,
mhm,
going to the hospital. The students start, all of the faculty
yeah,
transfer from one place to another,
mhm,
and staff
yeah.
transfer from one place to another.
It was
Like,
about 150 staff too,
yeah,
so it was about 300 total.
that is
And it was 200 residents had started 2 weeks earlier because they start 2 weeks before the end before in June.
yeah, this is a potential recipe for chaos and
Right.
disaster, and
Yes.
it worked out. I'll tell you one of the things that you did that I think was very instrumental, and interestingly enough, some of us had this conversation the other day, was the Culture Sync program that you had put together,
Mhm.
and how the idea was we've got these folks coming over from Reno, we've got these folks from UNLV, let's bring them together
Mhm.
and have a solid culture
Yeah.
instead of a us them kind of a
Right.
situation. I thought that was brilliant to do
Yeah,
that.
I knew we had to do that, and the Reno people had been treated very badly. I mean, they really were treated like third-class citizens, not even second-class citizens from Reno, and they should have been treated the very best because they were doing all the clinical teaching for the students, and so but the good news was we had all these committees, and so I knew most of them,
Hmm.
and they knew me, and they knew the other people that were in education and that were working on making this whole thing happen. They were really an integral part of it. It wasn't that they were left behind or put on the outside or anything. We could really all work together.
It is really remarkable. You had physicians who were teaching, doing their clinical practice, very, very busy, and yet they're willing to meet after 5 or before
Yes.
8 o'clock to help build a medical school that's not even their medical school at
Right,
the time.
and it hadn't happened yet.
Yeah. Yeah. I
It
mean,
was,
that,
it was just a glimmer in the eye.
yeah, that's a lot of commitment.
Yeah, it
Like,
is.
and I think, that's your leadership. That's how badly people wanted a medical school in the state, how badly we needed and
Yeah.
still need a medical school in the state. Yeah, it's
Yeah.
incredible. Let's shift gears a little bit.
Okay.
I want to hear about some things that you think need to happen, not specifically here, but in general in medical education, because I mean, you know this better than me, but the landscape is changing so dramatically
Yes, it
right
is.
now.
And I can't even begin to even figure out all that's going to change. But AI is going to change a lot, and it's going to change a lot in medicine. It already is synthesizing the literature in a different way than has happened. So I think that's really good. The question is it actually real? And how do we know it's real, or how are we going to guarantee that it is real? And then how are people going to integrate it in their heads? I mean, how are they going to use it to help patient care? I think it really has the potential to help patient care. I mean, medicine went through spells of using protocols for different diseases that would say, get these tests and do whatever. So that's not something new, but it was never done very well, and people didn't actually agree with all of it. And now that you can have better data and better analytics of the data, I think that it's going to work a little better, but it's not clear what that's going to mean, and it's not clear what it's going to mean for individual doctors. It sounds like maybe you could just let the computer tell you what you ought to be taking instead of letting a person process it, and that's going to be interesting to see how that works out. It might be simpler that a doctor doesn't have to spend as much time, but even now, doctors are spending more time with medical assistants doing some of the work, and with nurse practitioners and other people doing a lot of the work. But that's one of the things that Nevada's not done very well, actually. They never let nurse anesthetists use their profession in Nevada very much. It's better now. It's starting to gain prominence. But in other states, a lot of the surgery is done by nurse anesthetists and not by surgeons. And Nevada never did that. They didn't really allow nurse midwives in very much. They're getting better at it now, but using different levels of people is going to be really important, and it's going to be important in the whole AI field too. It may make what the doctors do very different, but it may make the doctors focus more attention on how the AI is getting to the right answers,
Right.
rather than just treating an individual patient too.
It sounds like two things come to mind as you're saying this. One of them is it sounds like if AI becomes a team member,
Yes.
first of all, that we need better teams.
Yes.
And then if AI is a team member, then everybody wins.
And then you have to be sure that you can guarantee that the team member is really using the right analysis to get to the
Right.
right answers.
Right. And, this goes back to the thing that we've kind of a thread through this is
Yeah.
the idea of looking holistically
Yes.
at the people, the opportunities, the resources that we have to be able to
Right.
to improve healthcare in the state of Nevada.
Right. And then I think we just need to look at the science behind everything. I mean, I think it's the science that's going to actually come up with some cures for Alzheimer's and diabetes and things like that. And we haven't gotten even near some of those kind of things. And yet I see the U.S. fading out of that activity for the next few years because of the way politics are these days. And that's really sad, because if you lose a few years now, you've lost a whole lot of years and lives later on.
That's some valuable real estate
It
right now.
really
Yeah.
is. And it's really sad. I mean, the women's program that had been done at NIH for 30 or 40 years, following women and looking specifically at women's healthcare needs, almost went by the wayside completely in the middle of that project. And luckily, it got saved, but not all parts of it got saved. And the public's um, understanding of what's happening has been shaken. I mean, their understanding of how science decides that something is real or not. The whole bringing up vaccines again and saying that autism is caused by vaccines is just absurd. It's just it's outrageous, but people believe it if enough people say it
Yeah.
often, and if the federal government put it up on their website now, that it might cause. It's just it's
And
outrageous.
nobody sees the word might in that
No,
sentence.
they don't.
Yeah. It's, it's interesting because we had talked earlier about
And there's no
anthrax.
might in it either.
Yeah.
It's been it's been years.
Yeah.
It's
Yeah.
been years that it has been known that it's not.
I gotta say, I love that you're still passionate about all of this. I mean, and you should be, right? It's
Yeah,
important.
it's really important.
Yeah. We're in a different world right now.
Yes.
Yeah.
And so I hope we can get out of this world back into science having more meaning and people having more say and really understanding the science pieces of it, because I think the science is going to be, in the long run, science is always the good outcome.
Yeah. After the hospital, you came back a few months later, still
Yeah.
remarkable. And then eventually you retired
Yeah.
from the school. What was the decision there?
It was just time.
Yeah.
I mean, it'd been 5 years. It was just time to move on, let somebody else take over, new ideas.
It's interesting. 5 years is, I think, actually above the national average
It
for
is.
deans.
It is.
But those are deans who run a medical school, not deans who build it and then run it.
Yeah.
And one of the things that has come to light as we've been talking is you have been in all of these areas where you have created innovation and built and then eventually moved on. But I don't think any of these were things where you seeked out the positions. You were asked to do these things and then built these legacies that continue to today.
That's pretty much it. And I should actually tell you that I'm really enjoying right now, still working, not that much. I work maybe up to 2 days a week. And it's with what's called NHBC, um, uh, which is a group of people that are the major donors that donated the medical school building and then built the building.
It's a beautiful building, too.
It is a beautiful building. We had been planning it for the whole time, basically, that I was dean, but it was just we couldn't get it set, how it was going to work, who was going to do it, how the building was going to happen, how the money was actually going to come in. It was just almost impossible, but to be able to do it at a not-for-profit, which is what NHBC is, a support organization for UNLV and all of UNLV, but particularly for the Kerkorian School of Medicine, and has many of the donors, Chris Engelstadt, Lindy Schumacher, Mary Kay Cashman, and others, and then a couple of the doctors on the board now are Tony Marlin and Rob Macbeth, helping to guide what the organization is doing now. And we're in the process now of building a laboratory, an academic laboratory building right beside the School of Medicine building. But looking at other projects in healthcare in Las Vegas and making decisions and helping them decide what healthcare needs there are and what needs need to be filled right now. So we're talking about a lot of things like a biomedical incubator space at UNLV to help support new businesses starting up in Las Vegas that will build jobs and will build biomedical research. Cancer is another area that really needs to be
Yeah.
improved overall in this Las Vegas area. But it's nice to be able to work again on projects that are going to be helping healthcare in general in this community.
I'm smiling because I'm just overwhelmed at how you do all of what you do. Like, you started saying, "Oh, I'm only working a couple days a week," and then this list of
It's a
things
list.
that you're
Well,
working on.
and the other big list that NHBC is working on is residency programs. So we now have medical students, and now we've expanded the number of medical students. It went from 65 in Reno to it's now 65 or 66 here too, I think, and I hope going to be able to increase. And Roseman just is starting a new school, and Turo has more students than they've ever had. So we now have a lot of students coming out in our population, but a lot of them have to leave because there are not enough residency. Because there are a lot of specialties. Ophthalmology, there's no ophthalmology residency in Nevada. If you want to be an ophthalmologist, you have to leave the state. Urology, there's no urologist. There's no neurosurgery. There's no lots of specialties and lots of fellowships. There's not a single pediatric fellowship in the state except in psychiatry. That's the only pediatric fellowship in the state. So anybody that wants to be a pediatric cancer diagnostician has to come from outside or has to go outside. So adding that is really important. And so NHBC, the Nevada Health and Bioscience Corporation is what it's called, is really looking to invest and to build buildings too, because we can actually do things faster than other people can do it. This public health laboratory, the ground was broken last month. We're going to have it almost done at least by the end of 2026. So it's things that can get done faster if you have a private company doing it,
Right.
and getting it to happen.
Yeah, if that was a state project.
Yeah.
Yeah. As you're describing this, I'm thinking about what the medical district is going to look like in 5 years, 10 years.
Yeah.
It's going to be completely different.
Yeah.
Which
it already is
Yeah.
now.
Yeah.
Different. I mean, I still drive around and can't believe all the new stuff that's happening now.
Yeah, and we need it. I mean, we have a program called the North Star program, which is essentially talking with our folks at the school and practice plan about what the North Star is of the school and how each and every individual fits into that North Star, that mission. It is a moonshot for us, right? We talk about it as a moonshot because of where we are, but we're doing something about it. And, so much of that is you starting everything. Okay, we got two questions for you. One is, you looking back, what are 3 or 4 things that you're particularly proud of?
Well, just the students, I guess. We've done an amazing job at getting really a lot of Nevada kids. I think not quite as many now as there were, but we had all Nevada kids in the beginning, and now we can get as many as we can get. So, and they're really, really super kids.
What have you learned from them?
How important it is to come from various different areas, cultures, backgrounds, economic strata, and how driven they are to actually make a change in the world, even though it doesn't seem like as good a specialty as it used to be. I mean, there was a while when everybody wanted to be a doctor because they made a lot of money. I think students now are much more objective about it. They want to make a difference. I think they're in it for better reasons and in a more altruistic way than it ever has been before.
The diversity that you talk about, and especially the first generation students, our students, I believe, see that as a superpower, not as a crutch.
Yeah, exactly. I have a new grandson that started out at UNLV in the engineering school this year, which is really exciting.
Yeah.
And it's exciting for me. And that was one of the first things he said was this is a very diverse. He did not come from came from Missouri, near Kansas City, and not a diverse area like this. And and what a difference it's made to him personally.
Yeah. Okay. Students is number one.
Students is number one. I guess the camaraderie, the companionship, the people seem to be really happy with each other and happy with the environment and what they're doing. I think that environment is particularly important. Um, I guess I think another important piece that's been an important piece of my life is not so much around the school, but it's just family. The family is just a piece of what you have to have and nurture as it goes along. And are ending up with something like 15 people at Thanksgiving
Oh, fantastic.
dinner,
Yeah.
which is family. I mean, that's just really important and stays as important no matter what period of your life it is. Even if it's a difficult one, you still have to make time for all of that.
Maybe even more so in those difficult
Probably
times.
more. Yes, you're probably right. More
Yeah.
so. Yeah.
Okay. So last question for you.
Yeah.
Moments of joy.
Oh my.
Moments of joy that you've had in your life.
Moments of joy. Oh my. I have so many of them. I don't even. That's hard.
You think of one that jumps out?
Well, I don't know. I don't know. It's hard to jump out with one. I mean, I went back to my 50th medical school reunion
Yeah.
last year and my 60th high school reunion, which was pretty remarkable just to think over 50 years. What was interesting about my 50-year anniversary, as I said, we had 220 medical students. It was also the 200th anniversary of Jefferson Medical School. It was the third medical school in the U.S. After University of Pennsylvania, and I think Columbia was second, and
Oh,
Jefferson
wow.
was third.
Yeah.
So 200-year-old medical school last year. And to be part of that and to really see the whole spectrum of what all's happened in that amount of time, and then to think about here, and we're at the 5-year, well, we're a little longer in the startup phase of it, but, that's gonna be another 200 years too, so looking at the whole spectrum, there's a lot and a lot to be proud of.
One of my moments of joy for you,
Okay.
the Barbara Atkinson auditorium,
Yes. That's yes, you're
and
right.
and more than anything is seeing how the students were with you when you were there.
Yeah. That that first class, I have a class picture of them that was taken when they started, and they look young and wonderful. And then we had some interesting times while they were students, but one of the interesting times was when the chancellor of the regents decided that I should be fired or I should disappear
Hmm.
6 months later. And the the students did T-shirts that said "My Dean" and had my picture
Yeah.
on them, and came to the Board of Regents meeting and talked. And then at graduation, which was 2 years after that, they did a picture of themselves with their "My Dean"
Yeah.
T-shirts
I
on.
remember those T-shirts.
Yes.
Yeah.
So yes, that was a real
The,
great moment, and the auditorium is special.
and seeing you with the students is special
Yeah.
as well. Like, of all the things you've done, all the remarkable things you've done, that connections that you have with the students and they have with you, that is, I think, the most special.
It's interesting because I was thinking about it at one of the UNLV graduations, the big ones, before the medical school was actually graduating. I went to all of them, and as I sat through it, I sat and thought about how many students I'd actually graduated as doctors in the different medical schools because as I said, we had 500 in a class almost 500 in a class for a couple years in Philadelphia, and then I had 10 years with 275 for a couple of those years, 225 for some of the rest of them. So it was over 3,000 students, and that would be a big graduation all by itself.
That would
to
be.
think that I had graduated that many students as a medical school dean.
And the impact that those students have had on other people, and it continues to ripple. I mean, the impact is beyond what you could count,
Yeah,
which
probably
is
true.
remarkable. Can I give you one of my moments of joy?
Yes.
We were in your office in the academic building on campus. We didn't have any of this
Yes.
at this point. This was 2015. And you said, Mark, will you come over and work with me in the medical school?
Yeah.
And I still remember that. And you changed my life.
I remember it too. And I needed you because I had nobody who understood the university, the real university. And I really needed that because of all the issues of just explaining what the school was to the regular university, to get them to understand that we wanted to be not only a part of it, we wanted to be an integral part of it and not to be like a stepchild. Or I think they still saw us as getting their money, stealing their
A
money.
threat.
And, their programs would be better if we didn't exist. And that's always not true. It's always better when you can have more.
It's always been about improving
Yeah.
healthcare in the state.
It really has.
And I'm eternally grateful to you, Barbara, for giving me the opportunity
thank you.
and for being here today. This has been fantastic.
Well, that's good. I
Yeah.
agree. This was really
Yeah.
fun.
Thank you so much.
Thanks.